I became very interested in hand surgery itself because of the fine detail in anatomy and the necessity that we all have to use our hands in the day-to-day life. I view it as one of my personal goals to get people back to as much activity and certainly as much work as possible through hand surgery and hand therapy. So I see a wide variety of patient ages from pediatric to adult. My joy comes from getting them back to the activities that they like to do. For pediatric patients, running and playing or high-level sports activities. For my older patients, I like to see them back golfing, playing tennis, and working with their hands on a day-to-day basis. I offer a wide variety of procedures for the hand and upper extremity, including arthroscopic treatment of hand, wrist, and elbow. And that arthroscopic treatment includes some simple sports injuries, injuries that are due to arthritis, as well as a variety of other conditions. I also offer treatment for fractures of the entire upper extremity, both pediatric as well as adult. And I also perform joint replacement surgeries for the fingers, the wrist, as well as the elbow. So I finished my fellowship this last year in hand and upper extremity surgery, so I feel that I'm up to date on the latest trends in hand and upper extremity surgery. Also, this last month I went to the American Society for Surgery of the Hand meeting in Boston and learned some more specialty techniques for elbow surgery as well as scaphoid fractures. When you walk in the door at Orthopedics, you should expect not only friendly service but also expeditious service. When you come in to see me personally for hand and upper extremity issues, we are prompt with getting our x-rays. I will review the x-rays personally and then try to maximize conservative efforts. So hand therapy is the most important part of my practice. It's essential preoperatively as well as postoperatively for patient expectations and patient outcomes. Hand therapy is directed by an occupational therapist who has studied the upper extremity and specifically focuses in on hand as well as wrist and elbow conditions and to maximize patient outcomes. One of the other techniques that I'm familiar with and I was trained in is endoscopic nerve release. Traditional nerve releases involve a somewhat large incision to fully release the entire length of the nerve. This is very important for elbows, specifically cubital tunnel, as well as wrists, specifically carpal tunnel. The endoscopic procedure allows me to make a smaller incision, sometimes as little as an inch, to fully release the entire length of the nerve where it is compressed. One of my greatest joys is calling my patients the night after surgery and finding out that they are pain-free and they're very, very pleased by that. That gives me a sense of personal joy and achievement.